Hi, my name's Joe. I'm a nurse practitioner student at Franklin University, and my presentation today is on special population considerations in mental health. So the first population that we will talk about is geriatrics. So this includes any older adult over the age of 65. Mental health disorders in the elderly, while they have depression, anxiety, mood disorders, PTSD, they also have specialized disorders such as dementia and Alzheimer's. So approximately 15 to 20% of older adults have a mental health disorder. The prevalence of dementia increases significantly once you get over the age of 65. The economic cost is pretty substantial as the elderly population makes up a large portion of the US and is continuing to grow. So in the US, the older adult population costs approximately $83 billion just for mental health treatment. Aging and mental health is closely associated with the loss of loved ones, chronic illness, and decreased social interaction, which also can lead to more prevalence of mental health disorders, and cognitive function can decline as well, which also can lead to more significant mental health disorders. So the assessment and screening is pretty similar to the generic population, such as the GAD-7 and PHQ-9, which we are familiar with. Other standardized tools that we would use, you can have a geriatric depression scale, do a mini mental state examination that is used to screen for cognitive impairment. And we have the Montreal Cognitive Assessment, which also screens for cognitive impairment. Other considerations when assessing the older adult for any sort of depression, anxiety, or mental health disorder is clinical interviews or with the staff of the nursing home, or maybe a home health aide, family, and behavior observations also help us assess for mental health disorders in the elderly population. So treatment plan for the elderly population for mental health disorders, you want to start off with non-pharmacological, such as lifestyle changes. With your patients with dementia, are we practicing good sleep hygiene, which can have an effect on the cognitive impairment? Are we getting them out and socializing them? Are we participating in cognitive behavioral therapy, or even group therapy may be beneficial for that social aspect for the older adult? The pharmacological interventions, you have your SSRIs, SNRIs, mood stabilizers, and medications for anxiety. So considerations in the older adult. So the second generation atypical antipsychotics have less risk of the EPS, which is common, the shuffling gait and the tremors. You also want to avoid benzos in the elderly adult, as it is really can impair their cognitive function. Other than that, some medications may need a dose adjustment depending on the age of the patient, but for the most part, our pharmacological interventions are the same. SSRIs, a common one would be like a Remeron to consider appetite and sleep issues with the elderly population. So our next population that we're going to discuss for treatment of mental health disorder would be the perinatal and lactation. So major depressive disorder affects almost 20% of women during pregnancy, with a higher prevalence during the postpartum phase. You also have postpartum psychosis, which is rare but very serious if it occurs. So some risk factors for having mental health disorders during pregnancy and after include previous history of mental illness and lack of social support. You also can consider many people when they become pregnant, they may stop their pharmacological treatment, and that may lead to exacerbations of their illness. Mental health disorders can negatively affect a mother's ability to breastfeed and lactate, as anxiety and depression has a direct correlation on your milk production. And then here is the estimated cost that perinatal depression costs the U.S. healthcare system about $14 billion annually. So very significant. So assessment and screening, we have some basic PHQ-9, generalized anxiety disorder, and a postpartum anxiety scale. So really, we want to screen for maternal depression at each visit, okay, reducing the stigma and account for cognitive changes, as well as consider family and partner input when discussing the status of the patient. Even so, after the baby is born, at the baby well visits, we make sure to screen at the well checks for maternal depression as well. So the treatment of mental health disorders in the perinatal period, we consider for treatment of depression or anxiety both SSRIs and SNRIs. So for the most part, SSRIs and SNRIs are considered safe in pregnancy, but we need to do an informed decision making and risk-benefit analysis when continuing any sort of pharmacological treatment. In lactation, they prefer Zoloft as it crosses the fetal barrier the least. Avoid benzodiazepines, especially in pregnancy. So if treatment is necessary, you can consider Buspar. With mood stabilizers, medication like lithium may cause cardiac issues, especially during the first trimester, and valproic acid should be avoided as it can cause neural tube defects in the baby. And then consider atypical antipsychotics for severe cases of postpartum psychosis, but again, that would require some risk-benefit analysis. And consider if the patient is severe enough, that would require hospitalization. So in our LGBTQ population, this specific population faces unique mental health challenges due to discrimination, stigma, and social isolation. Depression and anxiety are very prevalent among this population, especially compared to the heterosexual counterparts. So it's 39% of LGBTQ adults reported depression versus just 18% in the general adult. One thing to consider in this population is the risk for suicidal ideations and behaviors. In this population, almost 30% of them report suicidal ideations, so a very significant amount. And due to the prevalence of mental health disorder, the healthcare costs of care for LGBTQ is therapy, hospitalizations, medications, and think of the economic burden of the patients who are unemployed or underemployed due to mental health issues. So assessment and screening in the LGBTQ community, some things to consider. As a practitioner, we have to understand their identities and how that influences their treatment. Avoiding assumptions when speaking with our patient, allowing them to talk and be heard about what their problems are, creating a safe environment that they feel comfortable sharing, as well as provide a safe space for them to discuss with their healthcare provider. For the most part, we use the same screening tools such as the PHQ-9 and the GAD-7 for anxiety, but they do have a scale for lesbian, gay, bisexual, and transgender mental health, which talks about specifically their barriers to health in that screening. So treatment for mental health disorders in this population really should be approached the same. Take into consideration side effects from things such as SSRIs and SNRIs. If the medication has a side effect of like sexual dysfunction, they may be less willing to take that medicine. They also, something to consider for this population is providing gender affirming care. So will this individual mental health improve if we treat any sort of gender dysphoria and help improve their mental health outcomes? Other things to consider: substance abuse in this population is very prevalent. So treating those disorders, allowing them to have community support and resources, as that is a big factor with their mental health problems. Affirmative therapy with their decision on their gender or sexual orientation. If we link them with counselors that are familiar with the LGBTQ community, and dialectical behavioral therapy is indicated for patients who have faced trauma, which is a large amount of the LGBTQ community. It's also worth noting that they may need treatment for HIV, AIDS, and also preventative therapy for HIV may help their mental health and give them a sense of peace, knowing that they are no longer susceptible to these diseases. So just consider that. So the migrant worker population has several mental health challenges with an increased risk of depression, PTSD, anxiety, and substance abuse. So their economic vulnerability, cultural adjustment, and discrimination influences the treatment that they receive and the quality that they receive. Often they have limited access to mental health, and that causes a burden and increased costs for when they seek emergency care or crisis interventions. Our social welfare costs may be increased due to the reliance on social services for support. So considerations for providing care to this population includes tailored interventions that are culturally influenced and providing interpreters and materials in their native language, as well as their reading level. So again, things to consider are use of appropriate translators and educational material at the patient's reading level, and then consider resources when offering treatment and what they can manage. The big thing when screening is that we use the language that they are most familiar with, but we offer the GAD-7, PHQ-9, as well as since PTSD is prevalent among this population, that we screen them for PTSD as well. So the treatment of mental health disorders in the immigrant and migrant population is similar. We use SSRIs, SNRIs, antipsychotics, medicine for anxiety, as well as mood stabilizers. So keep in mind, a lot of these patients are underinsured or have no insurance. So we need to be considering the cost of treatment when prescribing these medications. Also, some cultures might be less inclined to take medicine. So first-line treatment should be lifestyle modifications, and non-pharmacological treatments, as they have better adherence versus taking medicine. So the last one will be mental health treatment in pediatrics. So different mental health disorders develop during childhood, including ADHD, autism, as well as behavior changes. The prevalence of children with mental health disorders is very high. So 1 in 5 children in the U.S. have a diagnosable mental health disorder. And the mental health disorders cost the U.S. health system around $247 billion a year. So considerations for mental health is like family support and the developmental stage that the patient is in. So when we are assessing and screening the pediatric population for mental health disorders, it is important to consider, depending on the age of the patient, their input as well as family and teacher input on their behavioral observation. So regular screening is recommended for high-risk population, but also at the child's well visit it should be completed. So they have some specific screening tools. They have like PHQ 9 or 8. They also they have specific behavioral screening tools for ADHD and autism to assess for behavior changes in adolescents. So these are all tools that we use to assess and screen the population. So treatment for mental health disorders in pediatrics, we really want to utilize our non-pharmacological interventions. Play therapy. Does the family need therapy? CPT with a counselor that is familiar with pediatric populations would be beneficial. School counseling. Does the patient need an IEP? Are they struggling at school? Think about even if there's concern for like a learning disability, but they actually haven't gotten their eyes checked, so they don't have problems reading, they have problems seeing. So things to consider of that. They also can have like parent management training, and lifestyle modifications are a big one. So pharmacological treatments include SSRIs, Zoloft and Prozac are used if psychotherapy is ineffective. Also, things to consider are stimulants and non-stimulants that are used to treat disorders such as ADHD. So that is all things to consider when providing treatment for mental health disorders in the pediatric population. So here are my references used, and I hope you guys enjoyed this presentation, and thank you very much.